September is Prostate Cancer Awareness Month, and this year, the American Cancer Society is bringing attention to how Black men suffer a greater incidence and death rate when it comes to prostate cancer. I talked to Dr. William Dahut all about it. Dr. Dahut, thank you for joining us today. I know this is an important month. It's Prostate Cancer Awareness Month. What's the message this year? Where are we?
I think the really important fact that people need to know is that prostate cancer is very treatable when found early. And secondly, that it impacts certain racial groups in a disproportionate way. You know, here in Washington, D.C., I think it's particularly important because actually in Washington, D.C., if you're a Black man, you're 4 times more likely to die from prostate cancer than if you're a white man in Washington, D.C.
Wow.
And prostate cancer is striking because in Black men, you're more likely to be diagnosed with the disease as well as die from the disease, which is different from breast cancer, where white women are more likely to be diagnosed, so maybe more interested in active in screening, but less likely to die from the disease. So there's a biologic component for Black men, as well as probably a need to screen earlier.
I was going to ask, where are these inequities coming from? Where does it begin? Does it begin with getting that screening earlier?
Well, I think there are a couple factors. We do know that Black men are more likely to present with more advanced disease at diagnosis, and that about 10% overall of all men are diagnosed with advanced disease at diagnosis, but at least 30% of the deaths. So being screened earlier is important. We know there's a genetic component to prostate cancer. And if we look at Black men in Africa, there's also a very high risk of prostate cancer on that continent.
Maybe beyond the genes, is there something they could be feeling? How do they know, like, okay, maybe I actually need to get checked out, or is it an annual review and seeing your doctor?
So, the reality is most men diagnosed with prostate cancer have absolutely no symptoms of cancer. And many of the symptoms that you think about that may be symptoms, maybe difficulty passing your urine, urinary frequency, are much more likely from a benign cause, either an infection or simply an enlargement of the prostate. But a very simple blood test, which is much easier than the rectal examination, can really give your doctor a clue whether or not that you may have prostate cancer.
Okay, so Dr. Dahut, what do we need to know? What do people at home say? Here's what you've got to do from this point on.
Talk to your physician. It's a blood test. It's very easy to do. Secondly, when you're diagnosed with prostate cancer earlier on, you may not even need treatment. It may be totally fine for your physician to watch things for years and years and maybe even forever. Information is useful. So talk to your physician, get your family history, learn about your genetics. If you're a Black man, certainly go in earlier. And prostate cancer, if treated earlier, can have a very favorable outcome.
Thank you for all the advice today, Dr. Dahut. We appreciate it.
Yeah, thanks a lot for having me on.
Dr. Dahut also says they saw a decrease in cancer screenings during the pandemic. So if that was you, they're encouraging you to get back to your doctor's office for those annual visits.